Valerie Pritchett with ABC 27, and it is a pleasure to be here with you this morning at Hamilton Health. I was joking with Ms. Janine because we were talking about how far this organization has come. Started out in Uptown Harrisburg, and I remember going there to do stories, and then she was very excited to tell me they were moving here to 17th Street, and I was looking at this building, and I was like, ooh, that's a lot of work. She goes, oh, I'm ready, the community's ready. And so we went through that first phase, and we were all excited, and then we knew phase 2 was on the horizon. We had to raise that, what was it, $7 million, I believe, if I'm not mistaken. And she still had faith in the community and we would get it done. And here we are today with phase 2, which is exciting to see. So a big congratulations to the staff, the donors, and the community. Wonderful job. And just to keep in mind, I hear there's a phase 3 and 4. But it's a little down the line, but we look forward to it because you're doing such great things in the community, and we know how important being healthy is, so thank you. Well, it's my pleasure to get this rolling, and I would like to bring up Mr. Bill Lair. He is the Board of Capital Blue Cross Chairman. He was the chair of the Capital Campaign Committee, which I'm sure was a big task for the center. Mr. Lair is a respected leader in the central Pennsylvania community, and he's worked with and supported many of the region's leading nonprofits. Sir?
Thanks, Valerie, and good morning, everybody. We've got some distinguished guests here. Of course, the mayor is here, and he'll be speaking a little bit later. And I think I saw Senator Teplitz. Is he here? Yes, Senator Teplitz is here. Representative Patty Kim, where are you? Okay, Patty's here. Commissioner George Hartwick is here. Do we have any of the other commissioners? I guess not at this point. Anybody else I've missed? Okay. This was one of those projects that was destined for success from the start. First of all, the vision. The vision was right. And as you go through this building a little bit later this morning, you're going to see what I mean. But the vision was right. The need. The need was obvious. How could anyone argue with the needs of the folks who come to this facility? The leadership. Janine Peterson, CEO of Hamilton Health Center. Do I need to say more? And execution. What a team we had. Janine was there every step of the way. Candy Faree, along with Vera Cornish, were our perfect consultants, working with the staff here at Hamilton, specifically Kathy Lacumba. And then there was the campaign council. The campaign council consisted of folks who probably together have raised more money in this region than any other team that I can think of. So they deserve to be pointed out. Marion and Bill Alexander, Ron Drinovich, Connie Foster, board chair here, Michael Harris, who you'll hear from in just a moment, Graham and Esmeralda Hetrick, Rob Jones, Dr. Stephen McDonald, Jim Mead, Diane Nichols, Thelma Redmond, Jenny Roth, David Skirpon, Karen Snyder, Mort Spector, Bill Stout, Jonathan Vipon, Bill Warren, and Nate Waters. What a team. The end result is, Valerie said $7 million. We went $8.2 million in less than a year. Capital Blue Cross made an early significant gift, and many others followed suit, including our good friends at Highmark, and an eye-popping gift from our friends at the Stabler Foundation. There were many, many other gifts as well, and we're thankful for them all, and thank you very much.
It's great being overachievers and getting more money. That's awesome. And it is now my pleasure to introduce, as you heard earlier, Mr. Michael Harris, who has served on the board of Hamilton Health for over 20 years, and as its chair for the past 8 years, of course, as you heard, overseeing the expansions of Phase 1 and 2.
Thank you and good morning. On behalf of the board of Hamilton Health, I'd just like to thank so many people. We don't have time to do everyone individually, so I'd like to do it by a few groups. First, our donors, big and small. Thank you for believing in our dream and investing in us. Second, to Bill Lair and the campaign committee. What an amazing job you all did. I have the specific recollection of every time we talked about the need, every time we talked about the number, people took a pause and said, gee, that's a big number. But it was always followed by, but we can do this. And that we did, and I'm very, very thankful for your good work. To my board of directors, I'm very, very proud to serve as your chair. An amazing group of people who are from the community, users of the center, various people from around town, and they come together and work very hard with one purpose in mind, and that is to expand care here in Harrisburg and to invest in Harrisburg. And really excited about what we've done so far, but I think we have more to do as you look around this community and think about the opportunities that are there. We definitely have some more to do. Last but not least, our staff members, from Janine and the leadership team to really every person on staff. They haven't stayed here for our old facilities. I think you remember what they looked like. They haven't stayed here for the money. They've stayed here to serve their community, and they do an amazing job day in and day out, and I cannot thank you enough. In closing, I heard someone talking about the new Hamilton the other day, and they were referencing this building, and oh, it's the new facility on 17th Street. And I want us to all remember our history. While this may be a new building and a new phase for us, Hamilton's been around since 1969, and a lot of people have done a lot of great work for the center in the community, and that's really important to remember. I always think about two people that I had the pleasure of working with, is the late Dr. Claude Nichols and the late Valerie Payne, two real heroes who helped us get to where we are today. Lastly, this was a dream. This was Janine's vision, and she did a tremendous job articulating it and selling it to us. I think when we first decided to go around and talk to people about it, people thought we were all crazy and that we needed more care than we could give. But I'm really happy that we're here today. But again, I wonder what we all can accomplish in this neighborhood by working together in the future. So, thank you.
And as you heard, State Senator Teplitz is with us today, and he's going to say a few words.
Thank you. I thought I was just dropping by for a flu shot.
Didn't get yours yet?
It's a real pleasure to be here today. When I was first elected and took office, we wanted to get to know the important community assets in the district. I represent the city of Harrisburg and the surrounding area. And one of the first places that we came to was Hamilton Health Center. We met with Janine several times, and she and her staff gave us a tour and told us about the vision for expansion. We were pleased to be able to help support that by supporting the request for state financial assistance. But more importantly, we're very happy to have place like this in the community that we can work with to send constituents to. We refer a lot of people here on a regular basis, and also for special events, special things like the dental clinic last weekend and others. And so, this is an asset not just for the community, but for those of us in government trying to do our jobs well and helping to serve our constituents. So I'm very proud to be a partner with all of you to do that. Look forward to many more years of working together and continuing to support this great institution. Congratulations.
And now, Dauphin County Commissioner George Hartwick.
Thank you. You can hold your applause. First of all, one of the things I want to open from a comment perspective is when we talk about coming together as a community to take care of the most critical needs. There's a lot of people that have doubt. Some folks like to point fingers. But I'm proud to represent a community when the need is identified that steps up in a way that exceeds expectations. When folks know there is an issue, they know that there's a critical need to be able to serve individuals with the type of dignity, the respect, the high level of care that exists here at Hamilton Health. It doesn't matter what your socioeconomic background is, we all deserve the ability to have the appropriate health care. And this facility does it in a way that no other facility does. The only federally qualified healthcare center in this county. And in my role on the national level, we've got some disadvantages in Pennsylvania because physical and behavioral health are not in conjunction a lot of times. And the idea that there is a disconnect between what's happening with the social services, drug and alcohol treatment, mental health treatment, and physical health in our hospitals and our locations that serve individuals realize we need to be together. One of Janine's visions when she came into this place is to be able to make sure we have all those services in one location for individuals who need that kind of help. We need to have true parity in this nation. We know in our criminal justice system that the majority of the issues that we deal with are people who have not addressed their behavioral health issues, whether it be mental health, whether it be substance abuse, and being able to make sure physical health is a component of that, and it's offered in a way that allows folks to be well regardless of their background, regardless of their socioeconomics. We know we're going to have a healthier community. And I want you all to give yourselves a round of applause for seeing this vision and Janine for her leadership, being able to allow that to be happening. We also have something happening down the street here in a little bit at the old Schimmel School. We're going to be opening up a co-occurring facility for treatment of both substance abuse and mental health disorder at the Schimmel School. Again, a correlating relationship between physical and behavioral health that will allow us to be able to serve those needs in a very comprehensive way, and that was planned for. The idea of making sure that we have a relationship with Hamilton and making sure that those facilities exist in a way that provides a comprehensive and holistic level of services is critically important to this community. I know from our perspective, our community has significant needs. And there are issues. For any of us who have our head in the sand, we really need to understand, because we're in the trenches seeing hospital rooms with increasing demand for mental health and substance abuse. If it wasn't for Hamilton Health, we would not have the facilities and the level of care that needs to exist for people who really need help. We're in a changing environment in healthcare. We now have the ability to offer health care and expansion of Medicaid to over 500,000 additional Pennsylvanians. Being able to do that, Hamilton Health is going to play a critical role in being able to service those needs in a way that we will be able to address issues that have existed for years, but we need to do it in a planful way. I couldn't be more confident that we have the right leadership, the right team, and the right community to be able to step forward, not on our heels, but on our toes, to be able to really combat the issues that we're seeing. On behalf of the Dauphin County Board of Commissioners, I know we have put forth some resources through both gaming resources and CDBG funds We're going to remain committed to phase 2, and I hear now phase 3 and phase 4. We have a requirement, if we really care about our community, not just to talk about servicing the needs of people who need help, not just about talking about the ideas of mental illness and substance abuse as those people's problems. We need to stop talking about it in terms of somebody else. It knows no socioeconomic background. I've dealt with it. My family has dealt with it. I think everybody in this room has seen the issues that exist. It's time, again, for us to stop pointing fingers, and as you have done in this room, to be a major part of the solution of solving the issues, because people don't need to be in jail if they're not a threat to our community. They need to be in treatment. We need to make sure that folks who have significant health care needs are being addressed at the level and in the community where they exist. And because of Hamilton Health, we've got hope to be able to address those issues in a significant way and hopefully reduce our criminal justice issues, reduce the ability for folks to have barriers to healthcare services, and hopefully access to treatment. And you know what? It's all of our responsibility. It's not just government's responsibility, it's all of our responsibility. So on behalf of Jeff Haste, Mike Prees, and the Dauphin County Board of Commissioners, we want to join, and I'm going to abbreviate this, with the 270,000 residents of Dauphin County in commemorating the grand opening of Phase 2 and in celebrating the expansion of this patient-focused community health center. We applaud the capable and compassionate healthcare professionals at Hamilton Health Center for their unwavering commitment to this community. In grateful recognition thereof, we do hereby proudly proclaim March 10th, 2015 as Hamilton Health Center Phase 2 Day in Dauphin County. Congratulations.
Phase 2 Day. And now I would like to welcome up to the podium Mayor Pavan Fuss, been mayor just counting, a year and a couple months. And so we want to welcome him up to the podium. You may know him as well as the owner of the Midtown Scholar bookstore. And he has that we can do it, together we can do it attitude that he brought to the city. And so we want you to share your proclamation.
Thank you very much. Good morning, everyone. It is a joyous morning today. I want to just summarize a lot of what's been said here and say that I think it would be impossible to overestimate the impact which the Hamilton Health Center has had on this critical part of the city of Harrisburg, and indeed of the region. And I don't mean just in terms of the jobs that were created here, or the quality of the services that have been provided, or the ripple effect that it has had in terms of economic development, whether it be the Schimmel project that was referenced, or the shopping center project across the street, or a variety of other retail establishments that are all beginning to grow because of this center. But the most amazing thing to me is the spirit of community building which has come out of this center. And you see that if you look around the room right now. What a distinguished group of people all coming together to celebrate the success of the Hamilton Health Center. And we need to harness that, we need to build on that. This is the key to the city's revitalization. It's right here in the room. And we can leave here today inspired to continue to do more and be inspired to continue to build on what has been built here at the Hamilton Health Center. I certainly feel, and I know we all feel, I know Janine feels, that quality, affordable health care is really the bedrock of a free and decent society. And that's why this project is so important. And that's why this project has been so transformative. It's a real honor to be here. I have a proclamation. One of the fun things I get to do is bring proclamations to ribbon cuttings. I want to read a few just historic facts because I think it is important. Whereas the Hamilton Health Center was established to provide health care services to individuals regardless of their financial and insurance status. And whereas the grassroots efforts by community residents in 1969, as Michael mentioned, initiated the development of the Hamilton Health Center. And whereas the Hamilton Health Center has now grown to serve more than 25,000 patients per year. And whereas Phase 2 expansion of the Hamilton Health Center will allow it to serve thousands of additional patients right here in Harrisburg. And whereas the Phase 2 construction has provided 17 new rooms to the pediatric examiner area, and the increased capacity means increased health care to the Harrisburg community. And whereas the Hamilton Health Center serves necessary and growing health care needs in the Harrisburg community and is a federally qualified health center within the 30-mile radius of the city of Harrisburg, I now therefore proclaim, as mayor of the city of Harrisburg, that this day we commend and celebrate the expansion of the Hamilton Health Care Center. I thank you all for being here. I wish us continued expansion and good luck as we move forward.
Thank you, Mayor. And now we'll hear from one of those 25,000 people who get the services here as well as her family, who is Sarah Wheaton, and she also sits on the board for Hamilton Health.
Good morning. I am really proud to be here. I hope I don't cry through this. I have been a strong supporter of Hamilton Health Center for a number of years. When I worked as the executive director for the Dauphin County Assistance Office, and we were going through welfare reform, there were barriers. There were a lot of barriers, and some were health barriers. Hamilton Health Center stepped up. They were the first people that called me. What can we do? How often can we do it? And when do you want us to do it? And they came, and I'm telling you, our people were in a stage of flex. They had no health care, they weren't healthy, and they were told they had to get out and get jobs. Well, Hamilton Health Center took them on, and they helped them. They helped us diagnose their issues so we could find ways to resolve those issues. So I will be forever grateful for that. When I joined, I retired from the welfare department, and the first thing I did after I thought about maybe I should go on a vacation, maybe I should have a massage, but I said the first thing I did was call Janine and said, Janine, is there any way that you can find a way for me to be a part of the Hamilton Health Center? And she said, Sarah, come on up, and we'll sign you up on the board. And they did. I sent my resume, and they picked me, and I've been on the board ever since, and now I'm the secretary of the board. So I really am grateful for that, because I have been able to see things that I never would have been able to recognize, the hard work of the staff, their abilities to be so flexible in situations, not always dealing with the nicest people in the world, but providing them care even though they have issues. And it's important, it's very important that every human being be treated with respect and dignity, and Hamilton Health does that. I have 6 grandchildren, and all my grandchildren are patients of Hamilton Health Center. And I just want to tell you a little story. Not too long ago, I had to cancel my oldest granddaughter's doctor's appointment because we had a board meeting, and she went ballistic. I want to go. I want to go to see the doctor. I like my doctor. I want to go. Why can't I go? Now, I'm not quite sure if it was hooked with getting out of school early enough, but that's what she told me. And they have always, all of my grandchildren have always been treated very professionally, very kind and loving at Hamilton Health Center. And I wanted to go on and say that they will continue. And, this is what I wanted to point out. I have to point this out. Every time there's a news ad or a news announcement about children with mumps or measles, have they had their shots, and I see in faces of people that they're afraid. I'm not afraid. I don't get that feeling of being afraid because I know my children have had sufficient shots, everything that they need. They're checked out from the toes to the head. So that makes you feel, as a parent, so much more comfortable. that you don't have to worry about these things happening. I wanted to say one last personal comment. 10 years ago, my sister-in-law, she was dying. And I brought her to Hamilton Health Center because the other doctor she was seeing, he said that she had 6 months to live. So I brought her here, and we prayed about it, and we came. And I'm not saying that it was a miracle, but I'm telling you, it was a miracle. Because the doctor that she got, Dr. Williams, Art Williams, he said, we are going to work with her. And he did. She was allowed with a critical condition that warranted no hope. She was able to live 9.5 more years because of the commitment. You have to be there to see it. She needed much more than Hamilton Health Center could provide, but they were able to provide it by resources that they had developed. She didn't have prescription. She didn't have insurance. She had a terrible condition that needed a specialist. She had none of that. But they were able to work it out that she was able to survive for 9.5 years. And to that I say, thank you, because that meant so much to our family. And it's not just because it's Hamilton Health Center. They are dedicated to the uninsured and the underinsured. They are dedicated to people that have conditions that have been going on for years and never been treated. They take them in as they are, and they build them up from that point forward. So I just wanted to let you know that this is a different type of health system. These people are committed, they work hard, and they're a wonderful group of people to work with. Thank you.
And our next speaker is Kelly Lieblein. She serves as the Regional Vice President for Highmark Blue Shield, the largest health care insurer in Central PA. She has over 30 years' experience in health insurance and healthcare management, and she has a vast knowledge and expertise in sales, finance, and operations. You don't look like you've been at it for 30 years at all.
Valerie, I love you. Well, good morning, everyone, and thank you so much for being here. We're so proud to be here, and welcome to the Highmark Community Room. As everyone said, this was Janine's vision, but the talent Janine has is making that a community mission. And so we are all in it together, and we're so happy to support the mission of the Hamilton Health Center. It really does improve the lives of those in central Pennsylvania. And I think we said it before, delivering high quality, respectful, patient-centered care. And that care promotes access, treatment, education, and prevention, regardless of health, education, or insurance status. And in fact, some of those same phrases and ideas can be found in our own mission and vision at Highmark, which is making sure that we have high quality, accessible, and affordable care for the people that we serve. And that's really why we've partnered with the Hamilton Health Center, which has really proven to be an outstanding and trusted healthcare resource in our community, as we said, for over 45 years. We also share the belief that Hamilton Health Center is responsible for making a positive difference in the lives of people who live and work right here in our community. And that's why Highmark provided over $1.5 million towards this Phase 2 project to help complete it. And this 70% increase in space will, among other things, allow Hamilton Health to broaden its outreach in areas that Commissioner Hartwick mentioned: pediatrics, social services, HIV and AIDS, and mental health. And with this outstanding new facility, Hamilton Health has already been able to increase the number of people served by over 5,000. And that's over a 25% increase in just 2 years. And so that's a sure sign to know that you are not only here, but you're doing good work and that you care, and that word is really getting around, and that's important. And so for all of us within this community who partner with Hamilton Health, we know that we are really contributing to the health and well-being of people today so that they can have a more promising future tomorrow. And really, who doesn't want to be part of something like that? So on behalf of Highmark Blue Shield, I congratulate Hamilton Health on its success and growth over the past 45 years. And it has taken on this mission of meeting the healthcare needs of so many patients and families. And I hope the relationship that each one of you have as business and community partners will continue to grow and flourish in the years to come. So thank you all for your time and presence here today as we celebrate this milestone in the ongoing story of the Hamilton Health Center. Thank you.
And now, last but not least, a woman who really doesn't need much of an introduction, but as a woman who spent decades working in the healthcare industry, especially pioneering and supporting and working hard for those who can't afford insurance, low-income individuals. And she spent 16 years here at the center. Miss Janine, would you please come up?
Good morning, everyone. You probably can't see behind you, but it's great to see so many people come out as we celebrate Phase 2. It's all of you in this room that helped us to get here. It just seems like yesterday that we started on this journey, and quite honestly, back in September of 2012, we were out on the front steps of this building with a ribbon cutting for Phase 1 of the project. Through your donations, your contributions, and grants, we've been able to build out an additional 34,000 square feet, which is what we're celebrating today, the opening of this Phase 2 project. What did we do with this 34,000 square feet? Well, first of all and foremost, we expanded pediatric services for those most in need. We got stories from the nursery at Harrisburg Hospital that they were sending babies as far away as York to be able to get them care if they were on medical assistance. We used that story as a sort of a jumping off point when we created and asked Bill Lair to chair our campaign council. And then we reached out, and he reached out to all the people he named. They worked tirelessly to help us to raise the funds for Phase 2. This entire phase of this project was done with private donations through individuals, through corporations, and foundations. And we sort of put the icing on the cake with a RACP grant from the state, as Senator Teplett's support gave us that ammunition to really go after that with our advocacy from our partners at the Chamber and CREDIC. Once we completed this project, as I said, Phase 2 and pediatrics, we were right in the throes of the Affordable Care Act implementation. And we knew that a lot of the people that we serve really didn't have internet access at home. So we've created a resource room right here on our property for people to be able to come in and do enrollment into Medicaid, into the Medicaid expansion, into CHIP, as well as the insurances and the Affordable Care Act off of the grants.gov website. We have certified application counselors that help individuals to enroll in those insurances. So it's our goal to help that number of uninsured shrink dramatically as we move in. It didn't matter to us whether we were under Healthy PA or the expanded Medicaid. We were here and we've been enrolling people into those insurances. On the second floor, we actually added a second floor to this building. That's the only part of the building that didn't exist when we started. We have a video that rolls after this presentation. You will see what the building looked like when we started and what it looks like today. We decided we didn't need to build from the ground up. We had enough buildings in this town boarded up blighted communities, that if we just took the effort to turn something that looked really bad and no one wanted, we could really make it shine up. And I think this is a remarkable example of taking something that nobody wanted and we turned it into an absolute gem that's become an economic catalyst for this community. So on the second floor, what is located on the second floor? Our social services department is on the second floor and all of our administrative offices. That allowed us to close another building in the city, which is on Walnut Street. And we are thankful that right now we've got prospects for the purchase of those buildings so they won't sit blighted. That was really our goal, is not to have additional blighted buildings in the city. So we've been really advocating for those buildings to be sold and used in a really good way. As many of you know, when we moved in this building in September 2012, we built out 50,000 square feet of space. We thought, oh, everybody kept saying, that's a lot of space. That's a huge building. You'll be here and this will be adequate for about 5 years. Well, after about a year, we saw that this was not going to be enough space. So that's what made us move forward into phase 2. And so with phase 2, in addition to the 50,000 square feet, we actually built out the 34,000 additional square feet. The parcel of land that we have here is large enough, as Val talked about phase 3 and 4. That's the common question that everybody asks us, what's next, what's next? Well, you'll see we still have undeveloped parts of this building. We did not build out the entire amount of the building because we wanted to see what did we need next. And quite honestly, our goal first and foremost is to really put in vision services in this building. We partnered with the Rotary Club a few months ago, and we served over 200 children in about 2.5 days. The need for vision care is significant, and so if anyone's out there and knows that there is an optometrist or an ophthalmologist looking to come into our building, we would certainly welcome an opportunity to have that discussion. The idea, as Commissioner Hartwick said, was to make this a hub of this community. We not only have our medical services here, we have dental services here, we have mental health services here, there's a pharmacy here, and there's a lab here, and soon there will be x-ray and mammography here as well. These are through partnerships that we've developed. We know we can't do everything ourselves, but it's about collaboration. We are all about helping us and helping you to do what you do best in serving the common residents of this greater Harrisburg community. I really want to thank those of you who did make these contributions. As Kelly indicated, you're sitting in the Highmark Blue Shield Community Room. If you go on the tour after this presentation, you will see these kinds of plaques all over the building. They designate those individuals who actually contributed to our campaign. And we have a very, very special thanks to the Stabler Foundation, and you'll see their name on the front of the building of this facility, along with the Hamilton Health Center name, as well as Capital Blue Cross, who was also the 3 key contributors that really helped us to leverage the funds to really go after other resources in this community. Our development has enabled over 30,000 people to be served in this greater Harrisburg area. I believe all of you may have gotten a newsletter which actually shows the comparisons of before and after being in this facility. When we say 30,000 people, it's also inclusive of our WIC services and our social services, which many of you on the sheets that we gave you really reflect the medical, dental, and mental health services. But we are surrounded by the support of WIC, which we are the county provider for the WIC services here. And the social services that we have are case management services for pregnant women and pregnant addicted women to make sure that they have healthy outcomes of their infants. Our organization employs 180 people. We are a key employer in this community, and we are growing. We are looking for those individuals who are committed to serving and being on the forefront of what we're trying to do here. We're appreciative of CAT. If any of you have heard their commercials, I tell them thank you. We get free advertisement now because they put a 17th Street route on, which never existed before. It happened as a result of the Marbury Street Bridge closing. But once it reopened, CAT left that bus stop on there. So they travel across 17th Street now, making access from the further south end of the city all the way up, which was the first of its kind. And they indicated that they've done that because of Hamilton Health Center, that we are one of the key stops that they have, and they stop here 34 times a day. So we're really, when we talk about accessibility, there was some concern when we moved here from Uptown. Were we abandoning Uptown? Can the individuals get from Uptown? The answer to that is yes. 34 times a day, the bus stops in front of our building, and anyone that's on medical assistance gets free transportation to and from medical appointments. So there really is no reason why people can't get to our location. When we first moved here, there were some reluctant individuals, but those individuals, once they came to this building and saw the dignity and respect they were given by this staff, and you heard from one of our board members, Sarah, that's not a unique story. That's a story that happens every day in this building. People ask, why am I here? Why did I come in the culmination of my career to Hamilton Health Center? I tell them I found my passion. I know every day I can step out of my office and I can see a family, an individual, a child who we have helped. They go out of their way to help any and everybody. If you don't have insurance, you still get your medications. You still see qualified doctors, dentists, and nurses that work here. I may have had the vision, but it's the staff that work here that have done the phenomenal job. They're the ones who deserve all of the accolades and awards and recognition. I thank them all for sticking with me. I thank my board for believing in me and believing in this vision, because everybody did think we were crazy. It was a huge undertaking. So with that, we are going to conclude our program. If you'd like to have a tour, we are going to actually exit out of this door. There's a staircase that will go upstairs. We're going to go right up to the second floor. Our first stop will be in social services. We'll then separate you into smaller groups because we are currently conducting services in the building, so we don't want to be too disruptive on the floors. And then we will show you primarily through phase 2. However, if you do want a tour of phase 1, if you haven't been through phase 1, we will be more than glad to give you that tour. We'll just have to know which ones of you will want that phase 1 and phase 2 tour. When you do exit out of this direction, take a look at how far up the hall you have to go. That gives you the indication of the size of this building. It's kind of deceiving when you're outside, but when you look at that hallway, you can clearly see how large the building is. If you need to have, if you need assistance and need the elevator, we'll have someone that will take you up the elevator, and you can still meet us on the second floor. In closing, let me just explain what this room is used for. So this room is a multi-purpose room. During the day, it's usually used by our staff. There's a few tables that sit here, and so it's a lunch room. It's also a break room if people need to take a little break. But we've had community meetings here, and we really want the community to use this room. This is we want this to be the hub of the community. So we are able to lock off our building and just use this part. There's restrooms right here, small kitchenette. So if you would like, if you have meetings that you'd like to have in this community room, you can email us, let us know, and we can always make that available as long as the date is available. This evening, for example, the Foundation for Enhancing Community has already reserved it for an event that they want to do here this evening. So it is first come, first served. We get first preference if we have an event, of course, but we will make that available to you. But we also use this room for prevention and wellness. We don't do enough around prevention and wellness. We call our system a healthcare system, but it's actually a treatment system. You know, we're always trying to take care of a person after they have an illness. We want people to come for preventive services. We want well child checks. We want you to come for your annual exams. We want you to come in this room for our exercise programs. Just 2 weeks ago, we held a Pink Goes Red event. We partnered with Community Organization, one of the sororities in the community. We had about 70 people in here. We had 2 different exercise classes that went on. We had a juicing demonstration. We had one of our physicians come and talk about heart health. People were here, people were engaged, and we had our nursing staff here doing the screenings, health screenings, so that if you did come up with high readings, we could refer you. It's important that we focus on prevention. If we're going to make a difference in this healthcare system, we've got to begin to lower our cost, improve healthcare, and actually engage each of us in becoming more empowered about our own health. I know I don't do enough. And I know most of us in this room don't do enough. So again, we will be promoting that in the future. If you have health events that you'd like to conduct for the community, this is a place where people come. I know we see on the news every day about the violence that, that does take place. I think last night I saw on the news they put up 17th and Market Street again because there was something that occurred in one of the homes. But I can honestly tell you this community has embraced us. We love it here. We've not had one bit of problem here. You will walk around this building and there is no graffiti here. We have windows everywhere. We want it light because we didn't have any windows where we came from. But we don't have broken windows or bullets or anything on our property. So I would say all of those that are naysayers, if you're thinking about a business, think South Allison Hill. Think South 17th Street. We need the services here. Our employees, our patients all need those services. We are attracting people from everywhere, not just in the city of Harrisburg. The information, the newsletter we gave you will show that we're getting people, over 2,000 people from Cumberland County. They're coming from Upper Dauphin, they're coming from Lebanon, they're coming from Perry. We have become more of a regional hub for people in need. So thank you all for your support. I hope you will continue to support us, continue to partner with us. I look around this room and I see so many people that have helped us. I truly appreciate everything that you've done. Thank you.
Thank you, and the tours will now begin. And again, we want to thank you all for coming out today. We hope you really enjoy the tour and see how well this facility is doing in our community and how well the team here is making a difference. So thank you.